Hi, this is Dr. Paul with Car Injury Care TV, where we answer the most common questions regarding automobile accidents, medical and legal. And we're speaking with Dr. Nick Venturino of North Tampa. And so let's go ahead and just get started right in. What happens, how does a body heal? So when somebody has an accident, like a car accident or injury, take us through the physiology of what happens and how that body heals.
Your body goes through three specific phases of healing, the first of which is inflammation. It's a natural response that your body goes through to try to protect that tissue. So you'll typically feel some heat in that area. It'll be swollen, be very stiff and painful. And all of it is to keep you from using it too much and creating more damage to a tissue that's already been injured. After the body goes through its inflammatory phase, it starts to repair itself, which is the second phase, is called repair phase. So after the body stops with the inflammation, the body can go into repairing itself with collagen fibers. Now, if it repairs, it's going to repair itself no matter what. Whether it repairs correctly or incorrectly depends upon what type of treatment that's received for the specific injury that it goes through. So if it heals wrong, it's going to heal with scar tissue, abnormal collagen fibers, versus healing with the normal collagen fibers that would allow you to go back to a normal level of function. And then your body goes through the final phase, which is called remodeling, which is just trying to get used to and accommodate to this new tissue that it's dealing with, whether it's normal or permanently damaged.
Okay, let's step back and talk about inflammation for just a second. What kind of time frame roughly does the inflammation phase last?
It depends specifically on how much trauma has been done, but in general, just a few days, 3 to 5, maybe 7 days. Obviously, the more extensive or the more damage that's done and the deeper the damage is done, it can go on for years. But typically, in a normal routine situation, it's going to, the inflammation will subside in a fairly short period of time.
Now, what would you do as a chiropractor to help the inflammation phase?
Well, something everybody can do is use ice. Ice is an anti-inflammatory. It's very good in that respect. But some of the things
By the way, what does ice do? You
Ice,
hear that all the time, but what does it
right?
do?
Ice actually pushes fluid out of a joint, so it takes that blood that may otherwise be waste-ridden, that's just pooling in that area, and it gets it out of the joint. So it reduces the swelling, but it takes that blood out of the area, which means it's circulated back to the heart, where it can get new, fresh, healthy, nutrient-rich, and then sent back in after the ice is removed to help the healing process in that area. So it gets the blood and the fluids out, and then the fluids that come back in are recirculated and more healthy.
Okay, and then you would say, so ice, what else would you do to help with inflammation?
So everybody can use ice, but specifically what we can use in our practice with physical medicine is ultrasound. Ultrasound produces a specific ultrasonic wavelength that helps break up scar tissue. It helps realign collagen fibers more normally. But it also provides heat deep into the tissue, so it moves a little better, and it helps get rid of the inflammation that's built up in there. Electrical stimulation has an anti-inflammatory aspect to it, and it causes less tension in the muscle, so the muscles won't be so tight and causing more pressure in the joint that's affected. We also do mechanical traction. Mechanical traction specifically helps relieve the tension and the stress in the muscles by stretching them gently, so that there's less pressure and compression in the joints as well.
And what's your feeling on people that take like over-the-counter medication for pain relative to treating the inflammation versus some of these modalities you're talking about?
Well, studies show that over-the-counter pain relievers cause abnormal scar tissue formation. It's very common practice for anybody who goes into surgery, whether it's a regular surgery like a back surgery or a cosmetic surgery, facelift, tummy tuck, or anything like that. Their surgeons almost always will tell you, stop taking any over-the-counter meds 2 weeks before the surgery and 2 weeks after surgery.
And that's why?
Because it causes abnormal scar tissue. And it's very important for your body to heal as normally as possible. So when you're taking these medications, it naturally causes your body to heal with scar tissue, which is counterproductive to what your surgeon is trying to accomplish.
Now, are there any side effects with some of the therapies you talked about? The muscle stim, the ultrasound, the traction?
As long as the doctor's done their due diligence and you're not pregnant, you don't have cancer, you don't have a fracture, there's no abnormal side effects. As a matter of fact, there's not even really any proof that it has a negative impact on a pregnant woman or on cancer, but just to be on the safe side, we don't utilize them in those scenarios.
Okay, so the person, let's say they start getting out, they get therapy, treatment, et cetera, and they come out of the inflammation phase, they go into, you call the repair phase. What happens in the repair phase in a nutshell again?
Well, you've got a very succinct time frame to repair the tissue as far as range of motion and strength back to its normal. The repair phase, I try to tell patients, repair phase is kind of like wet concrete. You can mold it, you can write your name in it, you can put it into a lot of different ways, you can make it into a lot of different ways, but once that concrete dries, it's permanently that way forever. So we have this repair phase, this 12 or so week period that we can mold the tissue into as normal, strong, and flexible tissue as possible before it becomes dry concrete and stays permanent. And then the body has to adapt to this new abnormal change and try to figure out how to be as normal as possible with that adaptation.
So after the repair phase, you say that lasts, what, up to 12 weeks, as you said?
Yeah, roughly.
And then the next phase after that is what?
Remodeling.
And what happens in the remodel phase?
Remodeling is when your body simply is trying to deal with the new changes that have happened in your body, and that's typically, when it's trying to adapt to being a little less pliable than it was before because of scar tissue formation, and in general, trying to accommodate to having a weaker tissue because that tissue was damaged and it will never quite fully heal completely. So it's just how your body's getting used to this new tissue that it's dealing with.
Now, you talked about what you would do in the inflammation phase to help that. What would you do in the repair phase to help that? You as a chiropractor, what would you
The
do?
repair phase, we're going to do some manipulation, some gentle manipulation of the joint to help align the structure more normally. We would also do some strengthening and stretching as far as physical therapy rehab, where we're specifically doing TheraBand weight training to strengthen the tissues that's been damaged, to try to get them back to their strength level prior to the accident, and flexibility as well. Doing some stretching to, again, when a tissue gets injured, it gets tight and shortens, and we've got to try to lengthen that as close to normal as possible so that the function will be more normal.
And then in the remodel phase, what would you do in the remodel phase?
Remodel phase is some periodic adjusting, but it's trying to get you to be able to utilize all of the things that we've trained you in your treatment to do at home, because scar tissue is less strong and less flexible than normal tissue. So it's going to require, if you've got a permanent injury, it's going to require permanent therapy of some sort to keep you as normal as possible. So making sure that you do these exercises at home, they're simple, they're effective, and they don't take much time, but they're very valuable if you'll do them a couple of days a week. And we show you how to do all of that here in the office.
How long does the remodel phase last, roughly?
6 to 12 months.
Okay.
6 to 12 months. And then after that, I mean, you are what you are at that point. That's as good as you could expect to get, or as bad as you could expect to get. I mean, that's wherever we can get you in that 6 to 12 month period is pretty much where we expect that's the best that you're going to be able to get based upon the
And that's how somebody heals, period.
Correct, whether it's correct or incorrect.
And what they choose, whether it's medicine or physical medicine, is totally up to them. But that, you're saying that's how they're going to heal.
Right, so if you don't do anything to change the physical damage that's been done to your body, you're just treating the pain side of it with medication, then you can fully expect your body to heal incorrectly and have significant deficit from that, versus physically treating your body for this physical injury and having a much normal level of function. There may be some still permanent damage, but having a much more normal level of function predicated on the fact that you treated this physical damage with physical medicine.
Great, great. Okay, good. Very good. All right, this is Dr. Paul again with Car Injury Care TV.